physical therapist involved should be making the decisions that are going to lead the care of that patient. The patient's values and goals should also be held in very high esteem. The therapist should take that information according to the greatest literature that's available, devise a plan that is a comprehensive one, that is one that's going to address the acute concern of the patient or the client, and then also be something that the patient and client can carry forward so that their pain stays away. The patient has to be their best advocate, number one, because they have to find the setting in which they're going to be treated with their outcomes in mind. Many times the therapist, as I've said, is up against other barriers that may preclude them from delivering the best care or the care that they really would ultimately choose. And so if the patient is armed with that information, they're really going to be ahead of the game in being able to choose a therapist and choose the setting that's going to treat them the best. Well, the physical therapist absolutely should be making these decisions. The physical therapist has knowledge in pain science, has knowledge in movement, has knowledge in many different sports many times, and so our clients come to us from a large variety of places. When the patient is armed with the knowledge that the therapist setting and the type of care that they should be getting is within a certain paradigm, they're really going to be ahead of the game. The patient's goals, the patient's own outcomes should be taken into account with the best evidence that's available. And then the therapist can coordinate with the patient in developing the best plan, the most comprehensive plan to rid that patient of pain at that moment, and then also make sure that that pain is not something that can creep back in because all of the other problems that the patient comes to a clinic with have been dealt with. General practitioners and MDs are absolutely qualified to decide whether or not physical therapy is a mode of treatment that a patient needs. The problem is that many don't understand that there's a difference between the different physical therapists. A physical therapist working in a physical therapy mill may be extremely talented and have excellent skills, however, don't have the time necessary to address many of the patient's concerns, educate the patient optimally, or really provide the undivided attention like we do at Spark Physio. We work with our patients very hard so that they understand that they can also let their MDs know that there's a different approach to being seen in a physical therapy setting. When a patient comes to us from a physical therapy mill, which is a very common occurrence, a lot of times they feel that physical therapy didn't work for them, and the generalist practitioner or the MD really didn't do the best job at describing what that scenario would be like or that setting would be like. And if they did, most would probably choose a setting like Spark Physio where a lot of the care is one-on-one and very outcomes and patient-centered. Insurance companies are important for reimbursement of a lot of different types of treatment. They should not be involved in any way at deciding what type of care you're getting at a physical therapy or any other setting for that matter. If a physical therapist is performing therapy, manual, therapeutic exercise, or otherwise, that therapist deems it necessary for you to receive that. And so in no way is it just when an insurance company denies coverage for that treatment, but you hear that story very often. When an insurance company has a stranglehold on a clinic, and in physical therapy mills that is the case, volume becomes a priority, not quality, and the patient's own outcomes really go by the wayside, and it becomes about driving units and driving patients, and again, the numbers game that is seen in a lot of physical therapy mills. Many people who have been seen in mills like that, where they accept every insurance company, can relate to the being seen with 2 or 3 other patients at one time and being moved around the room by a lesser trained individual, maybe like an aide or a tech. And that's not the one-on-one therapy care that we all strive to deliver. So your insurance company should not be involved in that process. If they are, and especially if they're overly involved, as in denying claims or saying that you don't need certain types of treatment, you need to make phone calls and you need to make emails and ask your therapist what it is that you can do to help solve that problem, because the insurance companies are far too involved in making decisions for us.